What's up, guys? This is Trevor Wicken from medxcoach.com. You're in the middle of a series on lumbo-pelvic hip complex dysfunction. Okay, for those of you just tuning in, that basically means low back pain, spinal pain, hip pain, sciatica, anything like that. Okay, this is John Strauch, okay, Viking King of the planet, actually German Viking King of the planet. He's just recovering from a 7-month bout of having an SI dysfunction down here, an L4, L5 issue in his back, some bulging disc, and then almost we think pretty much a herniation in L3. I think the MRI has actually confirmed that. So he's got a little bit of herniation. So we're actually working through the exercises that are going to get him out of this and ready to rock and roll again, okay? So we've done previous exercises talking about movement of the pelvis and then movement of that SI joint. Now we're going to work on this thoracic spine right here. Now, as you can see, he's a pretty strong, pretty big guy, and he has a pretty significant arch right here. That's because he has a lot of weight to carry and he had a low back pain, so he's dropping down like this. Most women are going to have that, and most people who have not trained themselves to stand up properly are going to have this as well. So this is one of the best exercises that I do, and I do with my clients, that works on this, getting more mobility in the thoracic spine. So you're going to have hands and knees. Make sure that your shoulders are nice and stable. So he's very strong in his shoulders right now. He's not shrugging, so go ahead and just kind of drop and shrug. That's weakness in the shoulder. He's not letting his shoulder blades shrug up like this where his neck's all crunched. He's nice and flat, okay? So what you're going to do is you're going to lightly pull up on that belly button without arching the spine. So drop that spine down a little bit for me, dude. So make your spine flatter. Okay, now just pull the belly button up lightly, like that. See, now it stays flat. Now, for all of you people, I know you've been in the 70s and I know you've seen disco, and we're doing the sprinkler, okay? But it's sprinkler in reverse. So what he's going to do is he's take his right hand, he's going to put his fingertips right behind his ear, he's going to pull his abs in, let that arm come down, keeping those abs in, and then he's going to go ahead and rotate up and out. So go ahead and come up, abs pull in, and right, he's going to feel that. That's about where his body says stop. Where do you feel that? Right through here?
I feel it more on the left side.
More left side down here?
Down towards,
down here.
Down there, yeah.
Okay, so he's actually getting some rotation going on and getting a lot of these movement patterns and these muscles firing in here. You may feel it in the low back on the other side. You may feel it in the mid back here, or you may feel it through the lats down. So go down again. So I've had people feel all three and up. It kind of depends on what's going on with your body, what muscles are going to be the tightest coming through this diagonal line right through here. The biggest key is to relax the shoulder and to keep those abs pulled up. Okay, down. And let's go one more, Johnny. Good. And up, and you're going to hold that 4, 3, 2, and 1. Good. Go ahead and put those hands down. All right. So he is moving now. He's feeling good. I saw him kind of turn his wrist like that. If your wrist kind of hurts, you can put your, you can actually grab a towel like this, like a rolled up towel, and put your wrist on that. That may give you a little bit more, or a little bit of less bend in the wrist, or just really spread those fingers apart and do it like that. Okay, that's the number one complaint I get on these things, these hands and knees, is wrist issues. So that's a good way to avoid that. Okay? All right, you guys, thank you for tuning in. John, give a flex. All right, we're rocking it.